One.
Hello and welcome. We are excited to have Paul Thacker here today. Paul is one of the good guys for sure. He's an investigative journalist, currently residing in Spain. He has a wonderful Substack that is a must read, I think. His focus is on as investigative journalist is on disinformation, and his Substack is titled The Disinformation Chronicle. He does a lot of great work, and he puts it out almost weekly. He won a recent award, a British Journalism Award, for his investigative work into the COVID vaccines and conflicts of interest. So we are extremely happy to have you on, Paul. Thanks for taking time to talk to us.
Great, thanks for having me on, guys.
So, Paul, I wanted to chat with you about, we could get right into it and talk to you about your recent investigative work that got a fair amount of buzz related to a PR firm, specifically a PR firm named Weber Shandwick that does work both for the CDC and for Pfizer. And you're based on the work you did and your Substack, Rand Paul even sent a message out to the CDC requesting information. So could you get us up to speed on like what that was all about?
So what essentially happened was, I was up one night, as I often am, like working too much, and I was looking at I can't remember like what I was looking at. I can't remember if I was looking at the CDC website or I was looking at or at Pfizer's website, but I just thought like, and I saw that Weber Shandwick was working for one of these, and I thought like, I wonder if they're doing it also for the CDC. And then I started looking around and I found like, well, sure enough, they're working for the vaccine company and for the CDC group that specifically works on vaccines and informs doctors and the public about vaccines. I thought, well, that's very interesting. And then I spent a little more time like, oh, they also work for Moderna. Surprise, surprise. Like who'd have thought that could possibly happen? Like in a regular normal democracy where we try to ensure that our government gives us unbiased information. And so I spent some of them more time looking into some of the people involved. And one of the individuals who was employed at the CDC, they were employed by Weber Shandwick to work at the CDC, and he described his job as Weber Shandwick embedded at the CDC, right? And this is simultaneously while Weber Shandwick is repping Pfizer and Moderna and providing public relations for them. And if you go back and look far enough and up the food chain, what the PR does, it's not just promoting them. Their job is to help these companies to get their drugs approved, to get their products approved. Like that's how they sell themselves, right? So that's where the real problem comes in, is when you have a government agency that is supposed to be educating physicians, educating the public about a product, right? Let's not talk about vaccines. Let's say like what it is. It's like it's a product. It could, so this could be anything. Like what I found shocking was that I didn't see a lot of liberals were confused by this, but I guarantee you, if I had found out that the EPA section that was involved in approving oil well drillings, that they were being staffed, their public relations section was being staffed by the same PR firm that was repping ExxonMobil and Shell, all these liberals would be freaking out on Twitter right now. But there's something very weird when it comes to vaccines, and I think it's partly because of public relations, that when you talk about conflict of interest with vaccines, a lot of the rules just don't seem to apply anymore. That's what I think is really odd.
Yeah, it is. I mean, that's the wrinkle that I guess is important to pull out, because I mean, on the face of it, you have a PR firm, and the PR firm. And again, there are only so many PR firms that can work at scale, right? So in our oligopolistic U.S. system that we have, I don't know. There's the big four accounting firms, and I'm sure there's like, I don't know, a handful of large PR firms, and it's not unreasonable to think that, well, the CDC of course needs a lot of help in terms
Right.
of getting their message out because they've been doing such a horrendous job. And hey, look, they're using a PR firm, and they happen to use the same PR firm that Moderna and Pfizer are using. But you're pointing out is that there's a that you think that it's possible that the sharing the PR firms is also has something to do with the approval process for the FDA for these drugs?
I don't see how it doesn't benefit Weber Shandwick to go back to clients and tell them, oh, by the way, we are also at the CDC. Like the other thing I can tell you is I have another story coming out like on Tuesday that Weber Shandwick also reps a CRO, which is a contract research organization called ICON, which is they oversaw the Pfizer clinical trial, right? So Weber Shandwick also reps ICON. They also rep the CDC. They also rep Pfizer. And ICON that does the public that is doing the clinical trials for Pfizer is also doing research, is also repping the FDA and BARDA. So like the problem is that we have this situation in which we have these companies who have multiple clients that they're serving, one of which is the government, and the other one of which is a for-profit company that has for-profit issues in front of these government agencies. In a normal democracy, I don't want to call America a normal democracy, but in a normal democracy, that doesn't happen. So
right. No, this is very interesting. But Paul, can you flesh that out a little bit for us? Because when I think about a PR firm and what they do, I think that, if they work for Pfizer, it'd be primarily, public relations, meaning the face of Pfizer towards the public. And, maybe they do damage control. If there's, a bad press about a product, they'll do some damage control, or they'll help them with messaging and that sort of thing. But you're saying that they actually help represent Pfizer or any of these, pharmaceutical companies in their process of approval of their drugs and products, or how?
of course they're shaping their job is to shape the public discussion. Like it's not about like just like like let's make things nice. Like they're shaping the public discussion. Like and I'll give you an example of this. Why is it that for so many years people thought that climate change wasn't real? Like, we don't know if climate change is real or not. We know now why that is. It's because these fossil fuel companies hired public relations firms, right, to create advertisements, to create discussions, to shape how we think. That's what public relations does. It's like it's public relations. Its job is to like determine how we think, the ideas we discuss, the questions we ask, right? And so that's what has happened in fossil fuel industry. But the thing you have to understand is that is child's play. The pharmaceutical industry they are NBA. Like all these other things are like high school, college. Once you get into the area of where you're talking about with the biopharmaceutical industry, that's where it becomes very professional, where the conflicts of interest become like almost like unseen, where things move back and forth all the time. And it creates the idea of like, why is it that like for so many years during this pandemic, anyone who asked questions about does this vaccine actually work or not? Is this vaccine cause side effects? Was called anti-vax. Like, do you think that happened? Like, that did not happen for no reason. That happened for good cause, because that's what the PR industry was doing behind the scenes. That's what they do. They create the idea, like how we talk about things. That's their job.
So is the CDC in this instance, is the CDC essentially being, I mean, they hired, Weber Shandwick on their own, presumably, but I mean, are they getting manipulated by the pharmaceutical companies to do their bidding? Or it so happens that the CDC, I mean, there's an intrinsic desire to make it to just harmonize the public conversation, if you will, so that there's a single message between all of them.
Because it does seem like, tagging along to what Michelle's saying, it does seem like there's this thing that's beyond just pharma, right? I mean, normally public health and pharma are kind of at butting heads, right? Normally public health folks are out there saying, oh, this drug costs too much. Oh, we have to limit pharma. Oh, we need Medicare to have the ability to negotiate with pharma, and pharma's pushing back. In this particular case, there's this weird well, it's not weird. I mean, whatever. There's this, thing that isn't happening before, where public health is battling.
Sleazy.
Yeah.
The word you're searching for is sleazy. This sleazy confluence of interests. Right. Yeah.
But it's coming. I don't think public health has I think there's this thing that you've pointed out very nicely multiple times in your blog. There's this and I think one of your blogs is titled that, like, vaccines are magic. Yeah. Like, vaccines are like, they're a therapeutic that lives on its own. They're like, they come from the elves or something, like the angels have given us vaccines, and vaccines can never be bad. Even though there's like, if anyone that knows the history of vaccines knows that, sometimes you've had dead ends and you've had to reverse out of those.
Sometimes they're bad. Yeah.
Right. But in this particular case, like, the fact that public health is normally at odds with pharma all the time, here we have like them kind of going all in with them. Perhaps this is simply that, hey, in this particular case, because, it's a vaccine that pharma is making, now public health is like, oh, anything that is vaccine is good. Therefore, yeah, I mean, that PR is good. This PR is good. Let's just do it. So they may not be, the point is, it's probably the case here. Would you agree?
It's because it's very good PR. When you believe the PR, that's how you know it's like really good PR. I mean, like, on any medical intervention, right? And I don't know like how it is for physicians, but like when you're taught to look as like an experienced journalist looking into medicine, right? Because like very few of us like have like, I have a biology degree, so like what do I know? I know what questions to ask. Like, I don't have a medical degree. I have a lot of friends who are physicians. I have a lot of family members who are physicians, so I know what questions to ask and stuff like that. But what I know is questions to ask, right? And the basic questions you ask, if you're an experienced medical journalist, is there's three things you want to ask on any medical intervention. Number one thing is like, all medical interventions have costs. That's the first thing you know. Nothing's free. Like, they all have costs. Then the next thing you ask is, there's three things you ask. What is the efficacy, right? What are the safety issues? And what's the cost, right? Like, that's the thing, right? And so those are the things you ask. With vaccines, all those things seem to disappear. It's like, it's all positive. It's all gravy, and it's very weird because like early on in the pandemic, a woman who's like, again, very well experienced, she ran investigations for the BMJ, and then she went over to the BBC. There's a woman named Deborah Cohen. And I remember I saved a tweet that Deb Cohen put out in early 2020, like right after the vaccines came onto the market. And I'm sorry, like early 2021, right when the vaccines came on the market, because the pandemic started in 2020, and then we had the vaccines were approved in late 2020, and then they started coming on the market in 2021. And I remember Deb put out a tweet where she said, like, I'm tired of being called anti-vax, I'm asking certain questions. So from the beginning, there was an obvious movement to push back against anyone asking questions, which is very disturbing, and then if you go further back, like, I noticed even before this pandemic started that there was a very strong push to label anyone asking questions about, not even about vaccines, but anything like about science, anything about like, could be like about toxicology of pesticides, about climate change, about whatever, like, but what do you think about vaccines? And you're like, what? Like, I'm not asking about it. I'm like, why are you asking these questions? And so when you begin to see these things, that's when you begin to like ask yourself a question like, why are these questions being asked? And normally that's because there's a PR movement behind the scenes, because the PR industry is oftentimes, when you look back and you look into them, and we know from the tobacco industry, and we're beginning to learn now from the climate change disinformation, that the PR industry is oftentimes like a year or two out in front of the discussion. And so that's the thing that I think is very interesting, is like, why is it throughout this pandemic we've not been able to ask questions, and then when you ask the questions, you're labeled or you're called a conspiracy theorist or you're called whatever, and then suddenly you're shut down. And that to me, I find to be very troubling, because we know, look, all of us know weirdos. Like, it's not like medicine is like, doesn't have its like freaks. Like there's a history of this stuff in medicine, right? But I mean, but this, in this period, it's gone well beyond that, into basically trying to shut down and denigrate people who just raise an issue, which is troubling.
Right. No, it's very troubling. And, I heard today, I haven't verified, this is from Steve Kirsch's Substack. I got sent a message with a link to his Substack, and Peter McCullough, who's a cardiologist who, was at Baylor, which is one of the, very good cardiology programs, highly cited, highly respected, was on editor of multiple journals. And apparently, not only is he no longer editor of all these journals, his board certification, as reported by this gentleman as a message he got from Dr. McCullough, his board certification in internal medicine and cardiology are both being taken away because he has disagreed, pretty publicly about a variety of different matters on COVID. So, so yeah, it's really weaponizing this idea of misinformation and disinformation, in a really troubling way.
Paul, do you see the footprints of Weber Chadwick getting involved with big tech or the social media? I mean, were they part of that, or how does that? Because I mean, certainly social media was instrumental in setting the tone of the conversation, right?
No, so I'm not totally understanding. Like, we're starting to see some of the outlines of this now become much more clear. Like, the only thing I can tell you is it's really funny. Like, I think I tweeted this out today. It's like, if I go back, and I've talked to several public interest people, like who just, like, when the pandemic started, they're like, well, this is vaccine work, and all of the public interest groups like shut down on this. For some reason, it's like it's all true except for like vaccines, right?
Mm-hmm.
Right.
And which I think is like just weird.
Yeah. But how do you know, Paul, that it's not vaccines are clearly like a holy cow. It's like a religion, right? I mean, certainly COVID vaccines, it's a religion. Like, cannot say, I mean, please don't, like, your career is over if you say anything bad about it. It's like, okay. But how do we know this ecosystem that exists is it's not just limited to this, right? I mean, how do we know, for instance, you mentioned climate change, correct? Now, I mean, again, I'm a cardiologist. What the heck do we know about climate change and the science of climate change? You probably know more about that than we do. But how do we know that? If you have people I know that say, well, climate change, blah blah blah, and they kind of scoff at it, those people are anti-science deniers, and they get treated the same way as the anti-vax community gets treated, right? What, how does one make sense of all this? I mean,
the thing I can tell you is, like, in climate change, for instance, there has been there is, so this is one of the weird things, right? You'll see on Twitter, for instance, on social media, like, there's a consensus that the vaccines work, or there's a consensus that whatever. Very seldom is there a consensus in science or medicine, right? It just doesn't exist. Like, you could you could argue that the Cochrane report is a consensus thing, right? You could say that, right? It's like a way of like evaluating like the best of the studies, but Cochrane can be wrong, and people disagree with that. But within climate change, for instance, there are consensus processes that have been happening for many years. Now, here's the weird thing, right? I was talking to a very well-known epidemiologist who's worked on vaccines for like 20 years. And as soon as the pandemic started, he noticed that all of the climate change science experts suddenly were saying, like, if you say these vaccines don't work, that's a conspiracy. Why are they saying that? Because they've dealt with disinformation from the fossil fuel industry going back like 20, 30 years. So they seized on this as, aha, this is the same thing that happened to us. It's not the same thing, because in climate change, there is a process, right? Yeah. We've had that's well established for evaluating the evidence. People come together, they do these evaluations, right? that doesn't exist in most parts of medicine. In most parts of medicine, like, I mean, like, what's the next? I think I saw the next just recently. Like, what is that drug that like was just getting pulled off the market, McKenna or whatever?
For what indication?
There's some drug right now that like people are saying like this drug should be pulled off the market, and it's been the standard of care for like 10 to 15 years. And everyone's like, so like 5 years ago, if you said this drug was bad, like you'd be disinformation. Like that's how it works. And
Yeah.
so, anyways, what they've chosen is here's how the PR industry has worked.
Yeah.
What they've said is, and it's been like, said a couple times. If you say that tobacco is bad and cause cancer, and if you say that climate change is bad, then you must accept the fact that also these vaccines are also good.
Right.
And you're like,
Right.
wait, what?
Yeah.
Like, I mean, like,
but your point, yeah.
we found that tobacco was bad because like we sued the tobacco industry and we got all these internal documents that showed us they were lying. We knew that the climate change was happening because like the science was pretty simple and scientists were coming together forever and saying like, we know the climate change is changing. Like we don't know, it's like we don't know how much it's changing. We don't know exactly what's happening, what the impacts are, but we know that like the climate is changing. And so because of that, then you must build on this. So that's what they do is they seize on their prior lies, right?
Yeah.
To say, aha, our next lie, you must also now accept, that's what they're doing.
Yeah, it's so it's so hard. Like the meat, the whole I'm sure you follow the story of the nutrition wars, right? Over the course of time in the U.S. and how the meat industry, right? And I remember, this has happened certainly even in the years I've been training, and definitely in the years that Michelle has been training, is that you've seen the science evolve a great deal when it comes to carbs and the food pyramid, right? Where, meat's at the top and you should have a lot of grains and have cereal every morning and Kellogg's, blah, blah. That when I grew up, my goodness, like to be healthy, you got to have your cereal every morning, Lucky Charms, right? And now like, I literally tell my patients, do not eat cereal. Stop eating cereal. Do not eat cereal in the mornings. It is not good for you. It is basically like taking sugar and dumbing down, but I remember so clearly when I was in training and I'm watching these documentaries about these congressional hearings and they had the meat industry there, right? And these documentaries were like, look at the meat industry and what they're saying about meat and how meat is good for you and blah, 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 and eggs are good for you. And of course, back then, in that little finite little period of time that you were in, it was the meat industry's bias and their propaganda. But now, of course, we're like, maybe the meat industry had a point there.
The other thing I can tell you is like when I was at Davis, I took one graduate course there, which was in animal science.
Yeah.
And my professors there, like, and one of the things we had to do was we had to do like a diet for an animal. So like you had to create like a scientific level like entire diet for an animal. So you had to know like all the protein requirements with amino acids, fatty acid requirements, energy, then all the vitamins like that. And the one that I did was a llama. And so what I did was we realized like we looked at it like there's a group of 3 of us. And we looked at like a llama is like halfway between like a sheep and a goat. And so we split the difference on a lot of these things. And we did this like entire like how a diet should look for a llama. Yeah. And one of the things that was really interesting to me is my professors at the time were telling me that human nutrition is bullshit because it's all based upon like these secondary things you test for. Because in animals, they can feed a cow something, right? Then they can collect everything. They can collect all of the feces, all the urine and measure it afterwards. And then afterwards, they can cut that animal up and see like what it looks like. With humans, you can't do that. So the problem with human nutrition is it's always off of secondary measurements for doing things. So it's not like the greatest science that we have because we're not totally studying these things, right? It's like I think that's a big part of the problem is like I can tell you right now, like when I was there at Davis, like I took classes at remember the guy like Klebing. This guy wrote the very first text. It was called The Fire of Life, that had to do with the fact that when you take in calories, that like essentially like the idea that the human body is a bomb calorimeter. Like you take in calories and you burn that's the amount of energy. We know that's not the case. I mean, like we know that like calorie in is not like the calories in, because like we know, like look at sumo wrestlers, like they consume calories differently throughout the day to get fat, to build weight. So we know it's not just about like how much calories you take in, it's like how you take those calories in. So even when I was taking these classes at Davis in the 90s, I realized, I was like, this is probably isn't the case. So I think human nutrition is like incredibly complicated, and it's partly why I don't get involved in human nutrition.
Right, but Paul, I mean,
it's hard. The science is incredibly complicated.
No, it's true, but at the same time, I want to come back to a comment that you made a moment ago, where you were comparing climate change and versus medicine, where you said that in climate change there's a consensus of scientists and whatnot,
right?
And they have their processes, whereas I think the CDC and the FDA and whatnot, they would push back against that. They would say no. Like, we have clinical trials. I mean, the clinical trials are the gold standard, at least. I mean, there's no clinical trial in climate change, and climate change is all speculative about, I mean, there may be a consensus, but they may say precisely that we have the clinical trials, we've run the clinical trials, and we have the experts, and so the PR is just for messaging, but it's not really influencing us all that much. I mean, because we have the processes that have been built.
So the problem is, when it comes to randomized controlled trials, is the thing we like, who controls the randomized controlled trials? Like, who runs them? They're like, I think I can remember like one that was run by the government, and that was that one women's trial back like 15 years ago that looked at the effect of some drug. I can't remember what it was, and found that it was bad, right? All of the randomized controlled trials are created and run by industry. And why is that? Because they want to control the questions that are asked and how those questions are then later evaluated. So when they say it's the gold, like I'll give you an example. One of the drugs that I investigated was a drug called Avandia, which is one of the top drugs being used to treat diabetes. I ran the investigations for the United States Senate on Avandia. It was a $3.2 billion drug when we first started looking at it. They kept coming back over and over again, GlaxoSmithKline, back to us and saying, well, RCTs are the gold standard. And when Stephen Nissen at the Cleveland Clinic put out his meta-analysis of Avandia, they said, well, like, that's just a meta-analysis. It's not the gold standard. Again, true, but also false, because the lie is that Steve Nissen has the money to run a clinical trial, a randomized clinical trial to test his hypothesis. That doesn't exist. So what we have is the ability to test whether there are side effects or not. Randomized controls, clinical trials are very good for testing efficacy and finding whether something works or not. They're terrible. They're terrible at testing whether something is dangerous or not. That's where they fail. On the climate change issue, where it comes like, of course, we don't have randomized controlled clinical trials for the vast majority of science. Geology has no RCT.
Mm-hmm. Yeah.
Space science has no RCTs. We still got on the moon. So RCTs are not the end all and be all, which some people in medicine are taught that, and they are very good, but for a very limited practicality. And so they're good at testing for whether something works or not, but the thing you have to do afterwards is to look, and you use other types of research to test for whether there's actually problems or not. Because these drug companies, they're not going to pay for that.
No, there's no disagreement, right? I mean, you have in front of you, I mean, you probably don't know that, but we've done a lot of work sort of being skeptical of the claims of the EBM movement and the clinical trial movement and whatnot.
Right.
And the reasons that you invoke are certainly totally valid. But my point here was that to say that climate change and other, I can't remember which other issue, that they're more impervious to PR influence than medicine or than vaccine, because they're
No, I don't think
intrinsic to
I
the.
don't think that at all. I don't think
Oh,
that at
okay,
all.
okay. So I
No, I don't
misunderstood.
think that at
Okay,
all. No. The way I say it as, and I'll be very clear on this, it's not that climate change is impervious to this stuff. No, this what the fossil fuel industry never did is they never invaded the science, right? The fossil fuel industry never invaded the science. They never bought off AAAS. They never bought off the Royal Society, right? They never bought off like academic research centers. They didn't. Well, that though they have, like, which I'm starting to like write about that right now. All they did is they just did PR. Why is
right.
that? Because it's very complicated for you and I. Like I'll tell you, the first time I reported on climate change was in 2004, and it had to do with a guy named Michael Mann, who's now a very famous climate scientist who's written several books and thinks he's the smartest guy on the planet, which he's not. But he's like a very decent climate scientist. And the first time I wrote about him was because he's been investigated by Congress. And when I looked into this, all I need to know about Michael Mann was this: does he publish in good journals? Is he a credible scientist? That's all I need to know. He's a mainstream scientist that publishes good things. And his major study, which was called this thing called the hockey stick, it had been replicated by other scientists, right? That's all you know. Like, that's the main thing, right? Like, that's the main thing that like determines whether you're good or not. Have other people replicated your research? That's what really matters, right? And so for me, that issue is very clear. But like, even then, I was scared to write about this. And I'll tell you why, because I'd never written about climate science. Yeah. And for me, it was very hard for me to understand that like humans could actually change the atmosphere. Like, that I didn't understand at the time. It was very hard for me to understand that like we as a species could alter the atmosphere. And so I think when it's something that is like hard for people to grasp, then it's very easy to manipulate people. Now on medicine, right? It's much easier. The average person understands that the pharmaceutical industry lies. Like, the average person understand that. Why is that? Because we've all encountered that. When I was investigating Avandia 12 years ago, right? I was, when it first came out that like that drug was bad, I disappeared into a hole in the United States Senate for like a week, 2 weeks. And then I came out of this thing and I was like walking on the street one day and I encountered this buddy in my neighborhood when I was living in DC. And I said, oh, hey dude, hey, great to see you. Like, I haven't seen you in a while. It's like, I went into this hole. I was like, I'm running some investigation about this drug that's really bad, or we think is bad. And looked at me, says like, which drug? Because like for him, as a college educated rando guy walking in the street, like he knows that there's been bad drugs. And so it requires much more sophistication for the pharmaceutical industry to create and sculpt this idea that their drug is bad. The other thing too is like within medicine, we actually have doctors regularly being bought off all the time that promote these drugs. We have studies that constantly infiltrate the medical literature. We have professional societies that are bought off, right? But on the counter side, medicine actually has the idea that there is a conflict of interest. That the people in climate change and other areas of science, they don't even understand this stuff, like conflict of interest, money influences. They don't get like, oh, that's just doctors. No, it's you too. So doctors are weird. Physicians are at both ends. They're at the cutting edge. They're totally like polluted with money, but simultaneously at the cutting edge of acknowledging the idea that there is corporate influence. So they're both things.
Right. No, you're absolutely right. But I think perhaps part of the reason is that, I mean, the government doesn't pay for our energy use directly right now, right? The government doesn't pay for, right. It doesn't tell us, it doesn't say, we're going to subsidize your cars and then we'll decide which energy source is the best. But in healthcare, the government is paying for healthcare, essentially, or subsidizing the entire healthcare industry, doctors included and whatnot. And therefore, and also saying we will decide, we'll have the FDA, we'll have the NIH, we'll decide what is the best treatment. And therefore, it's not surprising that the pharmaceutical industry would be invading the science um, in such a direct way in healthcare, where, you know, in the food example that Anish was using, or in the example of energy and whatnot. I mean, there's still, I mean, to some extent, the industry still has to, you know, they have to compete within each other and whatnot. Whereas here, there's a huge. It's much easier, I think, for pharmaceutical industry to just go in and manipulate the tools that the government has decided, because right, the FDA has decided the RCT is what we need, right? The RCT. So they've formalized the scientific process in a way that's very easy for pharmaceutical industry to say, okay, if that's what you want, we'll get in there, we'll produce the
Not just
clinical
that.
trials, and we'll exactly do it in a way that benefits us because we're in control of.
It's the amount of money that's just there. Like, I
Right.
mean, look, how much money is there actually in research for climate change? Look at the budget of the NSF. What is it right now? Like 10 billion?
Yeah,
And then
dropping the buckets,
and
buckets,
the
right?
NIH
Right.
is like 44 billion.
Mhm.
And then that's like just a parcel of what the actual corporations are funding. Like to bring a drug on market, like they're spending a billion, you know?
Yeah, but it's right. It's precisely because
Huge. The money there is
healthcare is subsidized, right? You know,
right.
nobody would buy these drugs. I mean, people would not buy all these drugs at the price that they are if they weren't subsidized, right? So
Right.
there's
Right.
no way. So the amount of money is enormous. And it's not just the research money, as you said. It's exactly, you know, all these huge programs that are all the monies that is getting, um, you know, that is funding all of this. But let's talk about the clinical trial. Let's talk a little bit, because it's related here. The pieces that you've written about Pfizer and its CRO company, and you know what you discovered in terms of the shenanigans when the vaccine trial was being conducted. There was a
Right.
whistleblower story. Okay, can you brief us about that so that we can see a
Sure.
little bit further?
So one of the big groups that was running the clinical trials for Pfizer is a company called Ventavia. And they're based out of Texas. And they were running a huge amount of the patients that were being brought into Pfizer's clinical trial. And there's a whistleblower who, what happened is this woman was hired by Ventavia. She had like 20 years experience, you know, in the research industry. And as soon as she walked in, she was like, okay, this is not good. Like, and she was like, kept seeing things that like were not up to standards. And then she realized quickly too, when she brought up problems, but like they didn't want to hear problems, even though that her job was to bring up the problems. It's really funny how to digress for a moment. Like the one thing you don't want to be inside of a company is quality control, or the guy who's like, I handle the whistleblower guys, like, you know, or I'm like people where people with problems go to. Like your job is to make that stuff, like it's like HR, like your job is to make that stuff go away. Your job is to catch these people who are complaining, like, oh, this is the guy complaining inside the company, this is the guy we have to deal with. Like if you're sophisticated, you understand after a while. And I don't think she quite totally understood that. And so she started bringing up the fact that there were problems in this clinical trial and how the company was
And here
functioning.
we're talking, just to be clear, we're talking about the pivotal clinical trial for the vaccine approval. Is that correct?
Exactly. Yeah,
Right.
exactly. Yeah. Now, what came out in our reporting, in my reporting, because that's what I could prove, was it was 3 sites and it was something like 3,500, whatever. But it was really around, when I talked to some of the whistleblowers, it's around 10% of the clinical trial, of this clinical trial. So, you know, whatever. Like, I mean, there was some idiot who's at Harvard who's like a statistical guy who's like, oh, well, this is nothing, doesn't mean anything. He doesn't know anything. He didn't like look at any of the documents that I had. He didn't look at the secret recordings I had. I mean, there were people inside Ventavia that were saying, one of the guys said, like, we know it's a cleanup on aisle 5. Like they knew that there were like huge problems, right? And so what does that mean clinically? What does that mean statistically for this clinical trial? Well, we don't know, because we don't know the total impact of the problems that were happening. Like when they weren't checking patients afterwards for signs, they weren't doing follow-ups, when things were being unblinded. It's hard to really evaluate that. Like, we know there were problems happening, but to me, here's the problem. I don't care that Pfizer lied. Pfizer lies all the time. That's what Pfizer's a corporation. Their job the job of Pfizer, just like the job of Nike, just like the job of Facebook, just like a job of any company, is to make money. That's what they do for a living. Their job isn't like protect your health. Like they're a corporation. Like their job, what they are designed to do is to create shareholder profit. Like that's what they do. Like, and so it's very weird when they're like, but they're a company, like, and their job, like, no, their job is to create profit. That's what they do. And so I don't necessarily care that Pfizer lied or didn't look into all this stuff. To me, the problem is why the FDA, after it was reported to them by the whistleblower, there were problems in the clinical trial, why they never investigated. Like that to me is like, that's like, I don't even know how to like explain that. Like, I mean, like, I didn't even know what to say when I saw that. I was like, it's like, what do you do after this? Like, you're the police, and I told you that there's a shooting down the street. And you're like, okay, and you didn't go and look. Like, what is my next step?
Right.
It's like, and what does that tell you about the police? Like, do you feel safe in your neighborhood after that? Like, if you ran into your police in your neighborhood, if you were like walking on the street and you saw a fire, and then like you called 911, you said, fireman, there's a fire here. They're like, okay, thanks, we can't go. And you're like, what do I do next? You know? Like, and that's a problem. Like, I don't really know what the issue is. Like, and what do we do next?
So it's interesting because
right. Pfizer hired them again. Pfizer hired Ventavia again to do more clinical trials for them.
Right.
And what I can only tell you is, like, what any person can think is, what Pfizer's interested in is data. They don't care how it comes or where it comes from. They just want to have data so that they can give data and numbers to the regulatory agency and get their products approved. Like, that's like, what else? How else is one, like, what else is one deduce from this, you know?
Right. So, you know, you're right. It's very puzzling. But is it an incompetence of the regulatory agency, the FDA in this particular case? Is it that they don't have the resources, or is it that, you know, it so happens that this is it's an agency that is under the influence of the executive branch, and it's interesting that, you know, there was a little bit of skepticism about at least, I don't know if you recall, but the vaccine was going to be the data was going to be released before the election, and there was a lot of people who are now, you know, big vaccine proponents who at the time said, oh, no, we can't, we have to, you know, Eric Topol delayed the release of the data, right, or petitioned the FDA to release the data. So the regulatory agencies are essentially, you know, I mean, it seems that they're under the influence of the political sphere, and it's hard not to, right? Huh? So if the election had gone differently, do you think they would have been very quick to go after this Vedantia, or, you know, this CRO, and look at their and ask for more data or whatnot?
I don't know what could happen after the election. The one thing I know is, like, look, you know, you can call it whatever you can call it, the bureaucracy, which is like what liberals like to call it. You can call it the deep state, that like people on the right want to call it. Like, it's like conspiracy when you say that. People on the liberals, like, it's the same thing. There is embedded within the American government people who want to make sure that certain things continue. The FDA, it's like, I'm not the first. There's books at your local bookstore that talk about the influence of the biopharmaceutical industry on the regulatory agencies, and it's not good.
Right.
It's never been good. And to me though, during this pandemic, like, when we should have had like really, I mean, look, these are brand new like technologies with these vaccines. You know, we were rolling them out very quickly, and it was like, don't ask questions, anti-vax. Like, that to me was like, I was like, wait, what? No, like, that actually, like, when you do that to me, that's gonna get me to like push back at you like very quickly. Like, I don't like to hear that. Like, no, you can't do that to me. Like, that's not how you can act towards me. The problem is the vast majority of people in the media, they fall in line to the point to where that, like, as one thing that I wrote on my, I'm gonna promote myself right now, the Disinformation Chronicle. I pointed out that that the woman who now runs the CDC said in a grand rounds just a few months back that when she saw the CNN story about the Pfizer thing with 95%, blah, 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 like, we thought, like, okay, this is it. So I went back and I looked at that story, that CNN story. That story was almost, except for like a small part, like at the bottom, which went into like how the vaccines worked, mRNA, it was almost a direct reprint of Pfizer's press release. So what we had was the media that was basically echoing everything that these companies said, to where that, if you go back and remember at the time, what happened is these companies would generate New York Times stories based upon press releases of their interim data, right? Interim data, like it's not even the real data. It's like they totally, it's like interim data, right? And then later, like another like press release about their data, which has never been looked at by anyone other than the company, which is crazy. That's totally crazy.
Right.
That's completely crazy that like you as a corporation or you as an individual, like just like you as a person could like, hey, here's what I think about this on my press release. And that's a story.
Right.
And no one can look at my, like, I mean, come on, look, we all went to high school, right? In high school, what were you told in math and science? Show your work. Like they don't want to see like this
Right.
is like this is the question, and you put like, and here's the answer. They want to see like you do the equation, so they know you didn't copy someone, you didn't lie. We had this as high school students, but these corporations that are determining public health issues don't have to do this. That's insane.
So, Paul, right? It is insane. It is insane, and you do terrific work in your in your writing and on your Substack and of bringing that to the surface. But can we? I mean, is it? I mean, don't we have just? I mean, it's isn't it just the way our society is, the way we've decided to handle these issues? I mean, it's impossible to, you can raise the alarm, you can on the vaccine and whatnot, but the structure is rotten, isn't it? I mean, there's a built-in.
The structure is rotten, but like there can be some reform. So let me tell you something. Like when I was in the Senate, now it's going on 12 years ago, I worked for Senator Grassley, and one of the things that I pushed for was because what we had seen when I first came on the staff in 2007, they had already seen with this drug called Vioxx, right, which was a pain drug, which we found out later the company had done all these manipulations with their clinical trial, cutting it short so that you didn't see the side effects, and was causing cardiovascular events. And what happened is the people I worked on the committee with were like, well, how did this drug ever get on the market? And so they went back and looked on the FDA panel, and they said like, wow, all these physicians were on the FDA approval panel for this drug. Like, I'll have ties back to the drug industry. Like, maybe start looking at the like ties between physicians and the drug industry. So what I did was I first drafted and then pushed through this bill called the Physician Payment Sunshine Act, so that you can look up your physician now today and see, is he or she taking money from a company and why? Like, what are they paying this person for? Okay. So that was something that I did. The thing that I should have done also, which I didn't realize till now, it took me like, actually, I realized it probably like in like 2009, but by then it was kind of too late. I needed to get out the door. I had to move on. I was being like targeted like relentlessly by the drug industry. What should also happen is that we should require these companies to disclose their data. If you're going to publish a study somewhere and it's like, this study, this says this based on our analysis, like, no more of this crap. Put your data out, like do your work, just like we require high school students in Omaha, Nebraska, that they have to like write down like how they did the equation and how they found the solutions. You drug company adults, with advanced degrees, you've got to do the same thing. We're going to hold you the same standard as a high school student in South Carolina. So you've got to put down your data, right? And so that's what we should do also, is we need to have data transparency. We need to require these companies to start publishing their data. And I understand there's some problems with this. In the research area, for instance, you gather data, then you want to do multiple studies. That's fine. You can sunset it, right? You can say like, okay, you get data, you publish your first study, and then you don't have to do the data and make it public for like another year, 18 months or whatever. But if you're going to go in front of the federal government and get a product approved that is then going to be used to treat people, potentially harm them, make that data public so that other people can look at it. Because there's been far too many incidences in which we found out later these companies were lying about either the efficacy or the side effects of their data. And I'll tell you one more thing. I'm sorry, like I'm yammering too much. When this thing first started, when this pandemic first started, I got a call from a very well-known and a very, very well-known person who's very well-known in science and in climate science. And this person was asking me, it was like, I can get like this vaccine, and this person's at the top university like in America. Like, I can get this and this and this. And I said, look, I've glanced at the data for Pfizer and Moderna, and then I think the AstraZeneca, I think it was coming online at the time. Like, and I see like, this is 95%, this is 84%. Like, I don't really believe those numbers because I have like a long history of understanding how this industry functions. So like, I just kind of erase all this stuff, and I kind of see them all as kind of the same, like in the same little stew of stuff. And the only thing I know about this industry is whenever a product comes online, we always find out the efficacy is lower than we were initially told and side effects are higher. That's what I always know. And what do we know today? The efficacy of these vaccines was lower than we were initially told, and the side effects we're beginning to realize were much higher. Mm-hmm. So that's how I think you look at this stuff.
No, I totally agree with you, but it's, but even if they made their data transparent, I mean, they could fabricate the data, right? I mean, they could lie. There's no,
you can lie, you can fabricate, you can't stop people from lying, but like, right. I think what you have to do is you have to have a process of making things public.
Yeah,
but okay, here's the thing about transparency, and here's why I was very interested in like making things transparent. I wanted things to be known because what I know is when people make things public, when they lie, right, the people around them or people associated with them can then look that stuff up and be like, that's a lie. And you know what that oftentimes is? Someone who's close to that individual, someone's close inside that company, right? Oftentimes, I love ex-wives. Baby, I love ex-wives. I love ex-wives, ex-girlfriends. I love grad students, right? Who slept with their professor and like, that guy's an asshole, right? Those are the people who I love, who's next to someone who really knows that person and then knows what they're really like privately, and they can see what they're saying publicly. And then they have the possibility to come out. But until you make that information public, there's no possibility of that happening. So that's the thing, is you have to make it public to have the possibility of someone coming out and saying like, what you guys are seeing and reading publicly is a lie. Mm-hmm. But you can't have that until it's public.
Right. No, I understand. But, my point is that I mean, it shouldn't be, it's kind of, we subsidize the pharmaceutical industry, by providing a market that they would never have otherwise, billions of dollars of money to buy their drugs. And then so that breeds corruption, that attracts the most corrupt. And then we have to, on top of that, then make all these demands, to prove, to get the transparency that we know we're not getting,
Right. But we also subsidize them. It's not just like providing a market. Like, we subsidize them through the NIH. Right. The NIH totally subsidizes them. Like, the NIH does the vast majority of the actual real research to identify clinical path, like metabolic pathways, genetic pathways to identify a possible metabolic like target or a genetic target. Like we do all that work for them, and all they do is like what they do is like they say like, aha, here's a solution. Here's the key to this. Like you found out like, in this building you have to go through here, here, and here, here, and here, and then you have to like unlock this one door, and we built the key for that thing when everyone else, like the government, paid for all this stuff, like how this building works, like what it is. All they did was like the little key at the end, and then they're like, okay, pay us all this money.
Right.
Yeah.
No, it's not, there's nothing about it that's just.
Yeah.
Yeah.
I think there's this need and a desire to, have good guys and bad guys. And I don't know. I mean, COVID has definitely should have been an awakening that, like, doing that kind of doesn't lead you to necessarily the truth, right? My concern is like take the drug. I know you've done a lot of work, with the in terms of disclosure of payments for drugs, right? In terms of drug companies paying physicians, correct?
Right.
So, I mean, I think I don't know that necessarily worked to remove influence from medicine, pharma, because again, I was going through training at the time, and like suddenly I went to a program where a training program where if pharmaceutical companies were not allowed to sponsor any grand rounds right anymore, which is fine. But the funny thing is that you still had these presentations that were basically presentations from, they may not have been the actual slides, but the people that were presenting, even fellows and trainees and whatnot, were presenting, basically a PR version of what it is, some pharma company, really wanted you to know in their product. Right. And so it kind of moved everything kind of underground a little bit. It moved large sums of, flow of money, into different places. Like there's different ways to funnel it as opposed to giving it to the physician. Right. Right. And so there's that. So, there's still a lot of influence, I think. And there's still, a crazy amount of stuff, I think, that's done in medicine today where you're like, oh, we're following the guidelines, and the guidelines are impartial, aren't they? And the guidelines are not impartial, right? The professional organizations and whatnot are, but then take something, in terms of how things are working on the ground now, right? There's a drug called there's a class of drugs called SGLT2 inhibitors that are diabetic drugs. It actually partly came out of the work you did with probably pioglitazone, right? Because we started to see these signals of bad cardiovascular outcomes with these diabetic drugs. So the FDA then went and said, every new diabetic drug that comes out, you have to have a cardiovascular safety arm, right? Otherwise, we're not going to approve. We're not going to approve the drug because we don't want to go through this pioglitazone thing. And lo and behold, one of the trials that was done on a new diabetic drug that was supposed to just ensure safety in terms of from a cardiovascular endpoint ended up showing that there was a significant mortality benefit, from cardiovascular mortality benefit, with one of these new class of diabetic drugs called the SGLT2 inhibitors. And so now suddenly you're faced with, most of the time cardiologists don't prescribe drugs, right? Don't prescribe diabetic drugs. But now you had this drug that was for blood sugars, and we have a lot of diabetic patients, obviously, in our patients that come through the door, and this thing significantly improves cardiovascular outcomes. Again, taking on faith, and it was replicated multiple times, and I think it's generally considered consensus.
I like how you say take on faith.
You're in the room. You're in the room.
Disclosure. That's the headline.
Yeah, you're in the room. I have to say that. So, yeah. But it's been replicated multiple times. Different drug companies have tried it, and so it's generally accepted by cardiologists, at least now, that SGLT2 inhibitors reduce cardiovascular mortality. And so, it looks like a good, and it's not a small amount. It's like a significant amount. So we thought, guys like me were like, wow, we should start prescribing this. And so so you start prescribing this drug, right, to patients that you're seeing that are diabetic, that are cardiac risk, and in the hope that you're doing something good for their diabetes and improving their cardiovascular outcomes.
I
And
like
then
that, with the hope. With the hope. I like that. I like that one also.
yeah, no, that's always with the hope. That's medicine and hope.
Right, yeah.
So, and then what happened is the drug companies, they have databases that they know which physicians are prescribing which drug.
Right.
So
Exactly.
I popped up on their list, right? Because
Right.
they were like, what the heck? How is this? Why this cardiologist is prescribing diabetes drugs, which is unusual. And
Right.
so, so a rep shows up at my office, right? And, starts talking to me and, bring samples, which I appreciate. I'm like, oh, great. Because, some of our patients don't have insurance or underinsured. And they're like, these things are great. And at some point, again, at some point, and they said, oh, do you want to, the cardiologists generally seem really scared of prescribing diabetes drugs. Why don't, would you like to give some talks to them? I said, sure, I'll go give some talks. And again, it's like talks in the evening, right? I mean, I have kids, and it's like, I mean, if they're going to pay me, that's great. So I go give talks to other cardiologists, and I think I did like 3 or 4 for the course of the year. And then after that, I was too busy, so I just wasn't able to do it. So I eventually stopped. But if you go and look, if you go, sorry, go ahead.
How much a talk?
How much a talk? It's around, I think 1,200 a talk. So it's about an hour's worth of work for around 1,200.
So, when it came out, like when I exposed the fact that Charlie Nemiroff, who was the chair of psychiatry at the time, at Emory, he was being paid $2,000 a talk. Yeah, people test because they're like, "Whoa, wait, what?"
Yeah. Right. No. Yeah. I mean, it's not a, but if you look me up in 2021, I mean, you can look me up now. You'll see these payments from this company to me. But that's kind of how it went on. Like it wasn't that the way that the way you think about it to be like, when you saw that payment, you'd be like, this company approached this cardiologist, paid them to give to, and that's why he's prescribing the drug. But I'm telling you, if you start out, if you have the data on like when I started prescribing and when I started, whatever.
But the thing you have to understand is that, like, here's the thing, is like what most people don't understand, like this is all about, like, again, this gets into all like corporate advocacy things. Very rarely do they approach someone and say like, hey, let me give you some money and then you say this. That's not how it works. What they do is they go through their system of people and they identify the ones like, hey, here's the guys we like that say what we're saying, and they amplify those voices. That's how it worked. That's how it's worked forever.
Right.
Like the tobacco companies, the tobacco companies never paid anyone off. Say like, oh, tobacco doesn't cause this. They found the guy who like really believed on his evaluation of the research that this is what it says, and they amplify the voices. So what the way it works is, it's not that the money corrupts the physician. The money, no. Well, a little bit, yeah.
I mean, it can. It's not that it can't. Yeah.
But the way it really works is it corrupts the system because it gives a bullhorn to people so that they have the bigger voice.
Right. No question, Paul. But
it's the same with politics. Like people will look at politicians and they'll say like, aha, this politician took all this money from this group, and that means that he's bad because he's like now going to be this way. Like that's not how it works. Normally the politician has this position already, and they push him in there so like that he gets an outside voice in the discussion. That's how it works.
So, but isn't that like how like human? I mean, isn't that how humans generally work? Meaning, so the point is that it's not that there aren't bad influences that are pushing physicians to do things that probably are not good for patients and are not good for the system. I mean, me and Michelle, I think, see that all the time. The issue is that if you paint with too broad of a brush, you just paint. It just the whole thing gets muddled, and then you end up in a world where you have like, oh my God, you want the schools open in fall of whatever 2020, you know that, and because Sweden's been open and because Europe is doing everything and everything's fine, you must
The thing,
you
the
must
thing
be
I've always
co-funded.
said, as a
Yeah.
guy who's married to a Spanish physician who is not
Okay.
paid anywhere near as much as either
Yeah.
of the two of you are, I've always said, if it's that important that you educate physicians,
Yeah.
you could do that without being paid.
You're
Yeah.
absolutely right. No, you're absolutely right. I think no, it's true.
No, but then why
You're
don't
also you're also getting a good dinner.
Yeah. No, absolutely. But no, but again, I mean, everyone, we're not all, I mean, not everyone, we don't normally operate like Mother Teresa operates, right? I mean, journalists have Substacks that are paid because you should get paid for the good work that you do, right, Paul? So, I mean,
but physicians,
yeah.
but here's the thing, physicians in the United States,
yeah,
physicians in the United States are paid better than physicians anywhere else on the planet.
No, that's true. Yeah, but so are plumbers. Plumbers in the United States are paid better than plumbers.
I can only tell you that, like, my wife is a research physician with an MD, PhD at the top hospital in this country.
Right.
One of the top 50 hospitals in the world.
Yeah.
Her MD is from the top hospital in this in this country. Her PhD is from one of the top research and and so I think when physicians in America like take money to go educate other physicians, like sometimes you just like do the things you have to do. My wife has never been paid to give like talks in front of the Spanish Pediatric Society.
Yeah. But yeah, well, it's a different.
It's a drama in my house when she does it.
No, it's a different conversation. But maybe she should get paid. Why shouldn't she get paid to like take time away from you and the kids and stuff to do that? But anyway, that's a separate point. The point is that if you paint, meaning that there are times that pharma is actually going to produce a drug that is actually good that you want more people to do that. So this whole system that exists of reps, and this is a different point that Michelle is making, which is absolutely correct in terms of subsidizing pharma and how it is the costs of it and stuff. But you have this system, right, of reps that are running around, going to doctors' offices, trying to influence and prescribe. The vast majority of the time, Paul, they are wrong. They are basically showing up, PR, they have talking points that are trying to convince the physician to prescribe a drug which has like this teensy effect, right? The point is that every now and then you have the meat industry ends up being right.
No, and so that is the problem.
So the
pharmaceutical industry is not the tobacco industry. There's no benefit to smoking tobacco.
Exactly right.
But the issue is, like, I mean, this is a reality. Like, why do humans live so much longer now? Like, and here's the reason why. Like, the vast majority of it, which people don't want to talk about, is public health improvements. Improvements in like clean water. Clean air, how we live, and then on top of that is medicine. It's like those things have provided benefits, and we all know this, and we all know that there are drugs that like are actually very good. The issue is like sort of like you said, like these drugs which are like sold for like crazy amounts of money for like negligible like improvements in health, or the other thing we know is health, which is how much money we spend in the last 3 months of someone's life. You know,
no question. But I think, but parsing that is going to require, I think, and this is what I want, and I know we're running over time, so we'll end soon, but parsing that is going to require science journalism to be much, much better than it is. Meaning, and so what we have, it seems to be that we have, you know, a lot of science journalists, I mean, that are, you know, again, that aren't really doing aren't asking the right questions, or just too interested in, just amplifying whatever message that goes along with whatever bias it is that they have. So, and you've kind of, and of course, it's having these, and you've done a great job of chronicling. It's not even journalists, even people that are scientists themselves that now are on Twitter, like Angie Rasmussen, David Gorski. You know, you've done a great job of chronicling a number of these folks. It seems like they're all just.
Let me ask something. Do you think David Gorski is paid by a PR firm, or do you think he's just like has an emotional problem, like a psychiatric issue?
That's an entire episode, but I think he's a true believer.
True believer.
Yeah, meaning the vaccines are a gift from the God that he doesn't believe in, right? So
Odd, right? Because like the first time I ran into him like years ago when I was working on like on pesticides, and he was saying like I'm an idiot on this, and like who is this guy? And then he started calling me anti-vax. I'm like, what is this guy? Like he's like, and then I don't understand like what does this guy do for a living? Like he's always on Twitter, like, and how does he see patients? Like, you know, he's supposedly like a practicing physician, you know. I mean, to me, that's so odd.
It
Like,
is.
what do you think of this guy really does for a living? Like, to me, that's weird.
Yeah, I don't know. I don't know. He supposedly is a surgeon, and but he is on a lot, and I mean, yeah, that whole crew is very very interesting, and I don't quite understand the psychopathology of that, or why it is they do it. But
I like the way you use the term psychopathology, because like that's a term in my head as well.
But what do you think? So what do you think? We'll end on this. Science journalism, right? How do you think science journalism has done, and you know, what do you think the trajectory here is in terms of where we're going to go? Is it going to improve because of the new kind of ecosystem we have with you and other folks on Substack, kind of producing good work?
I don't know like whether they're going to improve. And like I can only tell you like they definitely do not like me, because I definitely explain when they're wrong, and they don't like to hear that. Like anyone else, no one likes to hear that. And so I think what's going to happen is they're going to turn further and further. Like I see them as like a tribal group that like dances. They do their war dance around the fire. Like they all know each other. They all like talk to each other. They all like, you know, retweet each other's crap, you know. And but I think they've definitely become minimize, like not minimized, but like their power has receded a lot, and they know that, and that really drives them crazy, you know, that they like can like not just write something and people accept it initially. Now what that plays into is like I think that's why we have these fact checkers out there, because in the past you had major media outlets that could essentially just like determine like how we talk and how we think, because where else would you go? Like, I mean, you'd read your newspaper, or you'd watch the news, or you'd talk to your friends. But now there's like someone like me can create a Substack, like, and I have like a lot of experience, you know, in medicine and in journalism, stuff like that, and I can talk about these things. And so the only way you can deal with people like me is to label those people as disinformation, or label them as whatever you can. So I think that's the point of the fact-checking industry. Is I think that the government, and I think that powerful corporations got very pissed off that people could like just start like doing like we're doing right now, like having a discussion, and like, look, are like hundreds of thousands of people going to watch this? No, but there's people who are going to watch it, and one or two might share it with a friend, and it might influence the thinking of someone else. And I think that scares powerful people.
Yeah, can't agree with you more. And so, you know, I think this alternative source of information, which you know, and putting it out there. I mean, and just like you are, is super important. So, Paul, thank you so much for coming on. I'm sorry we ran over. I know your time is super important. So
that's great. We'll definitely have a link to your Substack called Disinformation Chronicles.
Yes.
On Substack. We'll on the show notes. We'll also have a link to Anisha's pharmaceutical payments that are now publicly available.
I only disclosed after Paul agreed to come on, because I knew he wasn't going to come on otherwise. His Twitter is also a must follow. It's at Thacker PD, THACKERPD. So it's really great. Thanks so much, Paul, for coming on.
All right, guys. Thanks for having me on. Have a great